Hi, everyone. My name is Dr. Dolores Tarver. I am a licensed psychologist here in Georgia, and it is time for the tea. Tea Time with Dr. Tarver was created as an opportunity to allow people to learn additional skills that will help you on your wellness journey. It is not intended to be a substitute for a relationship with a licensed mental health professional. So it is May, and here in May, we celebrate Mental Health Awareness Month. This is one of the months I look forward to throughout the year because it is really an opportunity where not only us mental health professionals focus on mental health, but other people bring some awareness as well. And we know that awareness is one of our best defenses against being able to deal with the difficulties that we have in our lives. So I'm going to be doing a 4-part series this month, and it will be focusing on mental health in families, mental health in our work environments, mental health and spirituality, and mental health in dating. So we're going to kick off today discussing mental health in families, the ties that bind. So I was again really excited about this series and trying to figure out what I wanted to cover, and there were so many things, so I'm going to try to make sure I stay on track. I've got my notes here. One of the things that I really want to look at whenever I'm talking about mental health is to make sure that I also focus on mental wellness and not just mental illness. And a lot of times we don't think about wellness when it comes to mental health, but that's just as an important part of being able to be preventable in terms of how chronic something could be in your life and how well you're able to manage it. So wellness is something that we're going to focus on today as well. So what I want to start with first is give you just kind of some working definitions for this series. And so when we talk about mental illness, what we mean by that is that mental illness can affect us emotionally, it can affect us behaviorally, it can affect us physically, mentally. And what it does is it can interfere with how we engage socially, how we function in our work environments, just us being able to do daily activities. And it also affects just how we think about things and how we perceive things. And we know that our thoughts affect our behaviors. And so when we're thinking about mental illness, we want to make sure that we're not using the labels and using mental illness as what we often characterize as somebody's character, as opposed to an actual illness. So just because you have mood swings doesn't mean you're bipolar. And we often talk about the weather and how it changes, and we say it's schizophrenic. So those will be examples of labels. When we're talking about mental illness, we refer to a person who has a mental illness. That person is not their mental illness. They have a lot of different aspects of themselves. Having a mental illness can just be one aspect of them. We do not utilize the terms crazy or stupid. We no longer actually utilize the terms retarded or slow. And so we want to make sure that we're removing those things from our vocabulary, particularly when we begin to talk to children about mental health, which I'm going to go into here in a minute. And we also want to make sure that when we are talking, that we describe people in ways that are affirming. Right? So a lot of times we are so negative when we talk about illnesses. And so we forget that there is a person underneath this illness. And so we want to be affirming in our language, and we'll get into that as well. So let's kind of kick it off talking about mental health and our children. So if you have a family member that has a mental illness, or you have a child that has been diagnosed with a mental health disorder, then it is really important when you're talking to children about it that you very much are aware of their age level and what would be appropriate to discuss with them. Now, according to the National Institute of Mental Health, about 25% of adults 18 and older and 13% of children 8 to 15 are diagnosed with a mental health disorder each year. So we're talking about a good percentage of the population. So the likelihood is that you or someone you know is going to be diagnosed with a mental health disorder. And I am aware that a lot of people have symptoms and they are not diagnosed, but we're going to talk as if people have been diagnosed. So what we know about mental disorders is that they come from a lot of different places. So there can be situational factors that create this mental illness. There can be environmental factors, how we grow up, how we learn, how we're shaped, trauma that happens in our lives, if we had abuse happen in our lives, but also genetic, biologically, we pass things down. And when you have family members, especially first degree biological family members that have been diagnosed with a mental health disorder, there is an increased chance that you also will be diagnosed with a mental health disorder. And we particularly know that to be true with our substance abuse disorders, as well as our bipolar or depression, ADHD, schizophrenia, those kind of things. And so it's really important for our children to have an understanding of mental illness, because if we have something in our family, there is a likelihood that they may be diagnosed. And so if we normalize the process with our children of talking about mental health, when something happens, they'll know what to do. They'll know to come talk to us about it and not suffer silently. And we'll be able to intervene early, because we know the earlier we intervene, often the better our prognosis. So people often ask me, when can I start talking to my children about mental health? And I will tell you, as soon as they're preschool age, it is appropriate. Now, 3 or 4, we do know they are very concrete in their thinking at that age. We also know that they are very self-focused at that age. And so we want to be appropriate when talking to them. We don't want to use a lot of language that they wouldn't understand and be very detailed. With smaller kids, we want to know that less is actually more. So we want to be able to give them kind of brief things that are digestible to them. Now, you can pay attention to your children. They will let you know if they are confused or afraid or uncomfortable. And at that point, you might want to back up. You might want to back up and restate something or state it in a different way. Or you may want to say, hey, we can talk about this later and do some soothing activities. We do not want to overwhelm our children. So we want to make sure that when we're talking to them, that they are able to handle it. Watch their bodies. Their bodies are going to communicate. When we want to talk about, again, mental wellness when we talk to our children, the importance of sleep, the importance of eating healthy foods, fruits and vegetables, the importance of water in their lives in terms of how it allows their bodies to function more optimally, because we know when our children don't get enough sleep, they tend to be cranky and irritable. And so if we talk to them about why sleep is important, it lays a foundation for them. And so that can help with that consistency of bedtime. We also want to talk to them about their hygiene. One of the things that can happen when individuals are struggling with mental illness is that they do not really have motivation to do much. And so they often neglect their hygiene. And so when we talk to our children, we want to include hygiene in their wellness, because we also know that if you don't take good care of your hygiene, particularly your dental health, that can also affect your mental health. We want to talk to them about emotional expression and regulation, and we can help them. It is so important for us to do things with our children, model for them, not just tell them, do as I say, not as I do, but do it with them so they can understand yoga and deep breathing and meditation and mindfulness and learning where they hold emotions in their bodies. Kids are often very anxious, particularly around something happening to their family members that they love. So they can be really, really clingy when they're, especially at night, when they're concerned about, hey, could something happen? So if we walk them through sleep hygiene, talking to them about how to calm themselves before they go to bed, what are some things we need to do? Turn off those electronics at least an hour before bed. Do some yoga meditation before you go to bed to relax you. Have this stuffed animal that may be your transitional object or your blanket or something that soothes you. So when you do feel scared, you have some things that you can do to be able to assist you. And then we have books that can be very helpful. Kids like picture books. So you can talk to them about what it's like to be sad or angry, right? Or if somebody hurts their feelings. So these are the types of things that would be appropriate for that age group. When they get to be about 5 to 9, then you're able to talk to them a little bit more, because that's when they're in that why stage, right? They start asking you a lot of questions about why people are engaging in particular behaviors. Why is that person not engaging in their hygiene? Why are we all wearing shorts and this person has on coats and they're hiding and they look like they're nervous? So you can begin to talk more with them about it, but they're also paying attention to our habits as well. Our drinking behaviors, our smoking behaviors. And we frequently get frustrated with our children and tell them to mind their business. But we really need to talk to them about what these things are, how they are used, what happens when they're overused. and talking to them about how to help people if they see people in distress or what to do when they are in distress. This is also the age where kids can really get a good wellness plan in place for themselves. So you can talk to them about how to have healthy friendships and how to do things that engage their creativity and how to learn about money. These are all financial wellness, environmental wellness, social wellness. These are things that you can start early. Wouldn't it have been really nice to have learned some of these things before you got to be 30 and 40 years old? So imagine if we arm our children early on with how to cope, how to regulate their emotions. But this is also the age where kids can really start to become responsible for their family members, especially if they're the oldest in the family, or if there is people in the family that have mental health concerns. I don't want to be the kid that's causing more trouble. You're already having to deal so much with this other child. And so I kind of shrink out of the way so that you don't have to worry as much about me. They can also get into a lot of perfectionism tendencies during this age and thinking that, hey, you only love me if I'm doing things that you really like. And so if I mess up, then you're not going to love me anymore. And so they can get, you can see a lot of those anxious behaviors come up, but also they can get really parentified and feel like they need to take care of you and be the one to be able to help with everything in the family. And so it is so very important that we teach our kids to be kids, that we do age appropriate things with them, that we help them understand that their role is simply to develop into the awesome human beings they're going to be, and not that they're responsible for us as caregivers or any of their other siblings. But we also want to talk to children about, hey, if you are feeling overwhelmed or scared or nervous, you can come to me. A lot of times we can be busy and it's not intentional. I don't think any of us set out to be dismissive of how our children feel, but we can inadvertently be dismissive of them when they do try to come to us because they are still children. So it's not like they're going to sit down and have these very long, drawn out conversations with us. Oh, I was being very thoughtful about how I'm feeling today, and I've noticed that I'm feeling a bit anxious. That's not going to happen at that 6 to 9 year old age, right? So we want to pay attention to them. Behavioral cues are really important still with that age group, seeing how they're engaging with their siblings, seeing if they're spending a lot of time in their room, on devices. Those can be telltale signs if they're changing, how they're looking, if you notice mood swings, that kind of stuff. So that is also an opening for you to be able to bring up and talk to them as well. And you want to be able to utilize a variety of support services. I'm going to give you at the end of this podcast some websites that you can go to. But there are some great books out there to talk to kids about all of their feelings, all of their emotions. On YouTube, there are some great resources to help kids walk through yoga and being able to calm themselves down. And we also want to talk to our children, and this is when it's a good time to teach them how to use their voices, to teach them about body boundaries. So they're learning how to navigate in this world as well. Now, our preteens and teens, of course, now you're in a whole different ball game. They're very much able to understand a lot more information. However, now they are going to friends to get information. And so it is very, very likely that they have some misinformation at this point about mental health, about wellness, about what's important in terms of their development. Now, what we want to do is we want to have an open discussion with our kids, not a lecture. None of us likes to be lectured to. Most of you probably already start checking out in this podcast after a few minutes. But we want to make sure that our children are able to have a conversation, a safe space to be able to dialogue with us, and be mindful that whatever you have experienced in your own life is going to show up as you're raising your children. So if you have embarrassment, if you have shame, if you have trauma, if you have anxiety, if you have depression, if you've had negative experiences with people, they are going to show up. And so we really have to be mindful of what we may be communicating to our children, even if it's not verbally, that they're picking up on. So if they have had any kind of negative experience themselves, then they're going to be less likely to talk to us. And this is where environment is really important in terms of shaping our kids in our mental, in their mental wellness. If you have avoidance-based coping, your kids are going to pick up avoidance-based coping. If you set up conditional love requirements, your kids are only going to feel like you love them if they meet those requirements. They can also end up getting in phases of a lack of motivation, feeling like they're going to be a failure. If we withhold attention from them, withhold food, right? The abuse kind of things come in. This is going to show up in their relationships with other people. And unfortunately, we see a lot of kids who are become very resentful and entitled during those preteen teen years because of how we've molded them. So we want to normalize for them wellness, but it's actually very important that we also understand not only mental health and awareness, but we know the law. Sometimes we end up inadvertently being abusive to our kids. We expose our kids to things, sexualized behaviors. And again, we're not coming from a malicious place, but there comes to be a certain age where our children don't need to see us walking around naked. There comes to be a certain age where our children don't need to be taking baths with other people, right? That's when they're needing to learn about their bodies and their boundaries. And they don't need to see us having sex. And they don't need to be exposed to sexual things. And so oftentimes we're not recognizing what they're hearing, what they're seeing, what they're picking up from our conversations, because our children are listening, as we call it, ear hustling. And so they're picking up things. And so we have to be so careful about what we're sharing in that environment. And now I don't want you all to go and feel guilty if you have inadvertently done some things, but here's a good opportunity to really check and see like, hey, what messages may I be sending to my children that I may be unaware of? So what happens then when we do see mental health show up in our families? Well, one of the things that I think is very common is that we often do not want to have this experience happen. Like, who wants to be dealing with mental illness? Not the person that has it, not the family members, because we know that illness doesn't just affect the person, it affects the family. So especially if it's one of your children, you start to feel really guilty. What did I do? Did I pass something on to them? Did I mess them up? We internalize a lot of that. If it's an older child, I've recognized when kids are college age and they go off to school, that may be their first incidence of, unfortunately, psychotic behavior. So if they have a bipolar disorder or a schizophrenia that's developing, often we'll see that as they get ready to transition into college, and they may have a psychotic break when they're at school. They had been perfectly fine up until then, and you're like, what is going on? Or they have their first panic attack, or their depression rears its ugly head. And so we're struggling trying to figure out what is going on. Why is this happening? Am I being punished? Did I do something? And so sometimes our first inclination is to be just dismissive of it, hoping that it's a one-time event and it won't happen again. And like, okay, well, let's just get you home and you'll be fine. And then we figure out that that's not the case. And this is going to end up being something long-term and not short-term. And we really can struggle with that. And so we try to find ways to go back to what life was like before this person got this diagnosis. And the reality is we cannot go back. We have to deal with who this person is. And remember, they are not their illness. They're still this person that you love very much. Your child, your sibling, your parents, your uncle, your aunt, your grandparents, whoever it may be, they're still those people. And they also are dealing with this mental health challenge. So once we get through that whole internalizing, we often go to this point of now we're being protective. So we don't want people to know what's going on with them. We try to keep that within the family. You all have heard before, what happens in the family stays in the family. And we particularly do this with mental illness. And we end up sometimes just kind of hiding this person away from the world. And what happens? They feel very isolated and disconnected. They are now internalizing shame. They feel bad. Whatever their hopes and dreams were that they may not have been able to achieve, or definitely maybe not in the way that they intended, they're grieving the loss of that. And now they feel like they're a burden. And now they feel like something's wrong with them and they're odd and nobody really wants to engage with them, because now all of a sudden everything that used to happen has stopped. We're no longer having people over to the house. We're no longer going out and going to dinner. We're no longer having family trips, right? And so their whole world has changed. And just think about how tough that may be. And we often have a misunderstanding and misperception about illness, and we can be very scared. When you hear the term schizophrenia, like that really brings up a lot of fear in people, because they're thinking, are you dangerous? Are you going to hurt me? What are you thinking? What's happening? What is your behavior going to be? When we are dealing with children, sometimes when they have spectrum disorders and they're having a hard time regulating emotionally, they get out and there's outbursts that they may have. They may get frustrated. And so we're concerned about, what are they going to do in this restaurant? How are people going to look at us? I don't want anybody looking at my child in this very awful, pitiful way. And I also don't want anything to happen to my child. What if somebody doesn't recognize that my child has this illness and they try to harm them because they think they're a threat? And so we're thinking about all of these things. And so we're pulling back. We're trying to navigate this. And meanwhile, the person who has the illness is caught in all of the midst of that. We don't know how to engage with them. A lot of times especially if there is a significant change following the expression of mental illness. So let's say a person does become psychotic. I don't know what to do with you now. I don't know how to talk to you. Am I going to trigger you? Are you going to be okay? What's my role now? And so we're changing our behavior. We're not really understanding the dynamics. We're exhausted. We're burned out. Caregiving can be very, very stressful, especially when you have someone who has a significant, severe, persistent, chronic illness. And so there's this constant, maybe in and out of doctor's offices trying to get medication regulated, or hospitalization, or they're walking away from treatment, or they're at the house and they become aggressive, and you're trying to call people to figure out what you can do to get them. And folks are saying, well, we can't get involved. They say they're not a threat to themselves or to others, and they really haven't done anything. They're just kind of posturing. So you feel just so helpless about, what am I supposed to do with this? You're grieving because you no longer have this person in the same way that you did. And it can become just absolutely overwhelming for you and for them. And we're gonna talk about how to manage some of those things. So I want to tell you that mental illness can range from very minimal symptoms to that persistent, chronic, severe. So the folks on that end of the spectrum, where it's severe, chronic illness, they're likely going to have a course of treatment that involves them being in and out of psychiatric hospitals. Medications, particularly when you get to that level of treatment, often have side effects. People don't want to have those side effects. They stop taking their medication. The symptoms come back, right? So you have a kind of revolving door. Then we have people who have more mild symptoms. They're very manageable. Sometimes they don't even need medication as much for them. They learn some coping skills, some behavioral things, and they're able to be able to successfully navigate their illness. And then we have people that'll fall somewhere in between. And so one of the things that is really important to do is understand your loved one's illness. What is the course of the illness? Does it get worse? Is it chronic? So that means it's going to be going on forever. Is it just something that happened because there was a stressor that triggered it? So it's situational, and it is going to resolve as this stress resolves. If there is any effects of other illnesses being comorbid, right? So does diabetes make it worse? They have GI issues. Does that make this illness worse? What are some of the other things that I need to consider in terms of looking at this illness? Do I need to look at their diet, what they're eating, what they're drinking? Does that affect? We know that in our kiddos, there are certain types of dye that can affect their behavior. We know that caffeine can affect people's behavior. We know nicotine can affect people's behavior, right? So some of these things can make an illness worse. So if we manage the food intake and the beverage intake, then sometimes we will see the symptoms lessen. So it's really important and that's why I like more of a comprehensive approach to mental health care. So we're looking at nutrition, we're looking at physical fitness and health, we're looking at medical conditions. All of these things go together. Spirituality, they all go together. So if we can figure out how this particular illness is affecting our loved one, then we can examine all these other factors and see what we can utilize to support this person in their illness. Now, I will tell you that there is a lot of information out there, but you want to make sure that wherever you're getting your information from is a trusted, research-based source. So there are podcasts with licensed professionals. You can see your pediatrician. There are psychiatrists that manage children and adolescents, as well as those that manage adults, licensed mental health professional in terms of counseling, treatment facilities. Do we have websites like the American Psychological Association? So you want to make sure that you're not just picking up information from unreliable sources. And why that is important is because when it comes to treatment options, and that includes medication, we can do more harm than good to people. And some of the reason why there's stigma around mental health and mental health treatment is that people have had a negative experience either with a mental health provider or when they're taking medication. We know that people have been over medicated. We know that people have been under medicated. So they're getting a lot of, when they're over medicated, they're getting a lot of side effects. And side effects can be really, really difficult, especially when you talk about psychiatric medications. There can be significant weight gain. People can have tremors. It can affect their ability to be able to walk, and it can affect their ability to be able to talk. They can have seizures. So there's some significant things that can affect their liver and their kidneys, right? So we want to make sure that our loved ones are getting adequate treatment and that the treating professional is an expert in the area where they're being treated. So they are less likely to have a negative experience. And unfortunately, there is a wee bit of trial and error when it comes to medication, because all of us do tolerate medications differently, and there's a lot of factors that affect how our bodies metabolize medication. And so sometimes a person will be on a couple of different medications before you get to one that's a good fit, or a few together that are a good fit. And that process can be very trying for the family as well as the loved one that has the mental illness, and being patient and working through that process can be tough. That is, however, often the best course of treatment is a combination of medication and therapy when we're talking about individuals that have more of that severe, persistent mental health kind of issue. Now, for people that's got mild symptoms, they may be able to be fine with just therapy and they may not need medication. But it is important to understand what are the treatment options for this person. And I need to do my research so I can understand a little bit as well, and consult with a medical professional so that I can understand. You can ask questions, get information, ask for resources, ask for pamphlets, ask for books, ask for good websites so that you can get information. And it's important to know how these medications interact with other medications, because we do know that sometimes we're getting side effects because we're having interaction effects. So we definitely don't want to be taking medications that are going to negatively interact with each other. When's the best time to take the medication? Does this medication have the tendency to cause my stomach to be upset? Do I need to eat with this medication? Not eat with this medication? Does this medication make me drowsy, so I need to take it at night? Does this medication cause me to be more alert and I need to take it during the day, right? So understanding the dynamics, the shelf life of the medication, how long is it actually in your system? And so when I start to see symptoms coming back, do I need to get another booster for an afternoon, for example, to make sure that we're managing your symptoms throughout the day? It may also be helpful to go to family counseling to understand what is going on, be able to deal with your own feelings about caregiving for someone that has a mental illness, or the changes in the family dynamics, because oftentimes other people in the family may feel neglected because the attention is shifted to this person. And then there is a lot of misunderstanding, again, about the illness, and blaming this person for this illness and saying they're doing these things on purpose. And so we get resentful. And so we need to be processing that as well. I think it's really important when I talk about a wellness plan, this goes for people that have been diagnosed with mental illness as well. Let us create a plan to manage this illness, to help this person be the most well they can be. And that includes a crisis management plan, especially if you have a loved one who has tendencies to be suicidal. And so sometimes suicidality comes along with a mental health disorder. And so people will attempt, or at the very least have thoughts of, and so we need to be able to manage what happens when this person becomes suicidal. Where do we go? How do we intervene? What precautions do we need to take in place and have at home for this loved one in terms of keeping things locked away or not having access, right? So when you have somebody, for example, that's suicidal, you may not want to have firearms in your home, or at the very least you want to have them locked up in a way where a person can't get to them. The same for if we have people who may be engaging in cutting behaviors. Where are the razors? Where are the scissors? Where are the knives? Right? So we have to be kind of thoughtful about those things. And that goes into this management plan of how we're being able to help support this loved one as they're dealing with this illness. What are my support services? What are the crisis lines? Do we have financial support that could be able to be helpful in terms of us? Because we know medication can be expensive. Counseling can be expensive, particularly if you don't have insurance. But even sometimes when you do, your copay can be very high if you have a high deductible plan. So how are we paying for their treatment? And are there some resources to be able to assist us in taking care of them and being able to make sure they get adequate care? Because all treatment is not equal. And we do know that sometimes people don't have access to good quality care. But is there a program that could pay for them so that we're able to make sure that they get the support that they need? I will also tell you that family members can be in very different places around how they want to manage a loved one's illness. Some people may say they don't need all of that. Other people may say they need more. And so we often will get into a wee bit of a dispute in families at times about care. So you, again, may want to utilize a family counselor or a treating professional to help intervene. Here's the facts. Here's what research says. We have evidence-based treatments, and those are the treatments that over time, through research, we have found work very well for particular disorders, right? So we want to talk to people that understand that information. Hey, we're recommending this treatment option because we know it has an 80% rate of being successful with this particular disorder. We want to also make sure that people have an opportunity to be educated about this course, again, of illness, why this particular treatment is important, but also what are some of the things that we may be seeing in this individual that we need to normalize as like, hey, this is a part of their illness. Because we get to the point again where we're blaming this person for what they're doing. We think they're being manipulative. And I'm not saying that people can't be manipulative, because they can, but I need to understand the difference between their behavior being a reflection of their illness and their behavior being a reflection of them trying to get a need met in a different way. And how can we teach them, and this goes to the wellness plan piece, how can we teach them adaptive skills? Like, hey, how can you get this need met without tearing up the house to be able to do it, right? How are we going to interact as a family outside of the home? Because again, we do not want our loved one to feel isolated. So we want to make sure they have support. And we want whatever concerns we have. People may have questions, concerns. Is this person safe? Can I bring this person around my younger kids? How do we navigate this? And so that is the type of information that's important for family members as well as we talk about this plan. With kids, if they are the ones that are asking a lot of questions about this loved one, it's sometimes helpful to talk to kids about physical illness and kind of equate it to mental illness, right? Because a lot of times children can understand that a person gets sick, they get a cold. Kids can understand that a person wears glasses to help them see. And so we can talk to them in those ways, give them examples in that way. They like visuals, they like stories, those kind of things, to be able to understand, hey, what's going on with this loved one that I see is pacing around the house and is talking to themselves, right? So what is going on with them? Well, you know how when you don't get enough sleep and you're really, really tired and you're cranky and you're kind of falling asleep in the car? Yeah. Well, that's what happens sometimes when people have, and you can decide how you want to talk about the illness depending on their age range. When a person has a type of illness that Uncle Jimmy has, it makes him kind of groggy and tired. And so you'll see him nodding and falling asleep. And it makes him kind of forget where he is sometimes. He's not sure. You wake up in the middle of the night and you're like, where am I? So Uncle Jimmy, sometimes it gets confused about where he is. And you know how you used to play with your action figures and they would talk to each other? That's what Uncle Jimmy does. He's kind of got action figures in where he can only see them and we can't, and they're talking to each other, right? So just trying to break it down so they can understand. And I think it's really important for that loved one who is dealing with a disorder, and whether that's your child or someone else in the family, to understand that your love is conditional and that they don't have to be good or not ill in order for them to be loved. And we want to focus on their strengths, because no matter what a person is diagnosed with, they have things that they do really well. Like I said, that person who you love and care about is still there. They may be musically talented. They may be very well read, and so they can share a lot of information about things. If these are your kids, maybe they have a diagnosis of attention deficit hyperactivity disorder or one of the spectrum disorders. Like they may be really, really gifted at chess or sports, or be really creative. And we don't want to just focus on what they can do either. We want to focus on some of their other abilities as well. They're very loving, they're very caring. You do a great job of helping mommy in the kitchen, or you do a great job of helping dad with the lawn care. Those are very stereotypical examples of gender roles, but nonetheless, but being able to allow them to see that they have worth, that they have value. That we don't label them and talk about their behaviors. Did you take your medication today? I can tell because you acting up, right? So, like, hey, baby, how you doing? How's your day been? What'd you do this morning? Did you have breakfast? Yeah. Take your medication with your breakfast? Oh, I forgot, right? So we don't want to just focus on their behaviors, because then that makes them feel less than and targeted, and kids will ask you, is something wrong with me? Am I slow? Am I stupid? Am I dumb? Right? They'll pick up on these things. So we want to make sure that they are able to see all of the different aspects of them as well, and not just this mental illness that they may have. And we want to focus on coping skills with our loved ones, and that's really important. How can they address their illness? That's part of their wellness plan. What can they do to have meaningful and purposeful activity? We get better when we practice, right? So having them practice different things is really, really important. Self-care is also important in terms of you as a caregiver. And I save this one for last because often this is the one that's forgotten, and I want it to be the last thing that you hear so it stays on your mind as one of the first things that you remember. You are able to have your emotions and your feelings. Having someone in your family with a diagnosable mental illness can be very, very difficult and challenging, particularly if you are in more of a caregiver role because they need more assistance. So you be honest about how you feel, because if you're not honest about how you feel, it's going to come out in these very unhealthy ways later on. And so it's also important for you to manage your grief about losing this person who you thought was going to be different, and accepting this person with their limitations and their abilities, having realistic expectations for them, but getting coping skills to deal with triggers, because sometimes people's behavior is triggering for us. They can be aggressive, they can be angry, they can be moody. The suicide attempts, and we can take that very personal, like why are you trying to kill yourself? Do you not realize how that would affect me, right? So we're having a lot of emotions as well, and we're getting triggered, and so we need to be able to have a space and a place to process that. So we have to attend to our wellness, our emotional wellness, our physical our financial wellness, our social wellness. So therapy may be very helpful for us too. Support groups may be very helpful for us. Being able to set boundaries, because as I said, not everyone is intending to be manipulative, but we do know that people can be. And we do know that even if people aren't intending to be harmful and hurtful to us, they can be. So I need to set some boundaries, right? So I may have to get a caregiver to come in there and help. Give me a break. Give me an afternoon off or a weekend off or a day off, to be able to get some respite myself, to get some rest, to recharge. You can say no to things. So a lot of times what we end up doing is, when we feel out of balance in one area, we just kind of throw ourselves into another area. My house feels like chaos, so I'm just going to work all these long hours so I don't have to deal with this. Well, I do not encourage that. I do encourage, however, you increase your wellness activities, finding stuff that gives you joy every day. What are your short and long-term goals? What are your activities that you do to decrease your stress? Make room for laughter. That's really important during that time. Who is your support people, the people that you can go to? What's your safe space? How are you able to kind of recharge and be able to take a break away, even in the house? Because sometimes when the house is a source of our stress, we find it harder to be able to de-stress there. But let me find a safe space. That's my closet, the car, the garage, the bathroom, wherever it may be, so I can have some peace for my own well-being in there. And being able to have a place where I can be honest and say the stuff that I would not say to this loved one in their face, but that I'm feeling, and I need to be able to process through that so I don't build up resentment and I don't end up having medical conditions, because we do know that stress is one of the biggest causes of why we end up having cardiac events, why we have GI issues, migraines, right? These aches and pains. There's a lot of ways that stress shows up in our body. So we want to make sure that we're attending to those things. So there are a lot of support resources, as I told you. Healthychildren.org, which is sponsored by the American Academy of Pediatrics. AACAP.org, which is the American Academy of Child and Adolescent Psychiatry, and I will drop these in the description. FFCMH.org, which is the National Federation of Families for Children's Mental Health. NAMI.org, which is the National Alliance on Mental Illness. Psychology Today, sponsored by Psychology Today, and then APA.org, which is our American Psychological Association. All of these websites have sections that are geared toward dealing with family members that have mental health disorders, children that have mental health disorders, understanding mental health disorders. This is also always research-based information. It's factual, it's accurate, so you don't have to worry about the content being misleading or not being up to date, right? So they refresh. You'll see articles coming out very frequently, and they have a lot of language that is very understandable to a variety of different age groups as well. They've got strategies, they've got books, they'll give you suggestions for things. I want you to know that there is no shame in being diagnosed with a mental illness. The shaming comes from when we are miseducated about mental illness, when we misunderstand the symptoms of illness, when we mislabel what is actually going on, and when we are mismanaging the actual disorder. So let's normalize mental health, and more importantly, let's be well. Take care.